Good morning. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Thanks again for joining me today. Well, it appears the Delta surge has in fact plateaued. Nevertheless, we continue to see very high numbers of COVID-19 cases and hospitalizations. Yesterday, for example, the 24-hour difference in cases reported was more than 4,400. If we compare that to 1 year ago on the same day, that number was a little bit north of 1,400. In addition, we saw 323 new hospitalizations reported yesterday, while 1 year ago, we saw 123. We are higher than we were a year ago, but I remain cautiously optimistic that we'll continue to see our cases decline as we move forward. I want to remind everyone about the timing of these numbers as we follow COVID-19 cases. The first data that we see is that a COVID-19 case is reported following a positive COVID-19 test. After that, within days or weeks, someone could become seriously ill and end up hospitalized and hence end up in those numbers for hospitalizations. And sadly, after a hospital stay or a weeks-long battle with the virus, a person could then pass away. Now remember, even then it can take weeks or even months to get verified data regarding deaths. So our mortality information lags even further behind case data. This all means that we may not know the full impact of this surge numerically for some time. But what we do know is that our hospitals are continuing to tell us that they are feeling the very real effects of the surge right now as they continue to face capacity challenges in their ongoing efforts to save as many lives as possible every day. So while it's tempting, it is far too early for us to claim victory. Although cases are declining, the situation in our Ohio hospitals remains very serious. The Ohio Hospital Association, for example, continues to report that 1 in 6 hospitalized Ohioans is COVID-19 positive, and 1 in 4 in the ICU is battling COVID. In our rural hospitals, we continue to see those numbers are even more stark, with 1/3 of hospitalized patients having COVID-19 and about half of all the patients in the ICU being there because they're fighting COVID-19. As this virus continues to mutate, the best thing that all of us can do to protect ourselves and to get our population, to get the state ahead of this virus, is to choose to be vaccinated. When more Ohioans are vaccinated, it lessens the opportunity for dangerous variants to take hold and helps us on our path to gaining control of this pandemic. Now, even as COVID-19 continues to spread across Ohio, flu season is also now upon us. As one would expect in mid-October, we are beginning to see some flu activity here in the state. Remember, as bad as it sounds, you actually can get both the flu and COVID-19 at the very same time. Now, the good news is that we have vaccines to help prevent severe illness from both the flu and from COVID. So now is the time to get your flu shot. And if you haven't already, it's also the time to get your COVID-19 shot. And remember, you can get both shots at the same appointment. All in all, the message is now is not the time to let up. We have to remain vigilant. We all have to continue to do our part to stay healthy. And this includes, of course, choosing to be vaccinated, as well as wearing a mask when directed and practicing other preventive measures like good hand hygiene and good cough etiquette. The steps we take today will protect us in the future, particularly as we approach the busy holiday season. Remember, if you're getting 2 doses of a vaccine, it can take up to 6 weeks or more to gain full protection. And Thanksgiving is just 7 weeks away. So if you haven't yet been vaccinated, now really is the time to talk to your doctor about it, get the facts, and then I would hope you choose to be vaccinated. Now, these precautions will not only keep us healthy, but they can also go a long way toward alleviating the pressure that is really being experienced acutely by our health system, especially our hospitals.